So good morning, everyone. So we will start. Thank you for joining our second Tuesday Connect. So just before giving the floor to Corine to present, I just want to remind you that this meeting will be recorded and the recording will be made available on the EU-JAMRAI YouTube channel. So if you don't want to be recorded, just turn off your camera and post your question, comment in the chat. I will let the floor to Corine to make an update on work package 5 on our work on country commitments. So Corine, the floor is yours.
So yes, hello everybody. Good morning. It's still morning. My name is Corine van Lingen. I represent the Ministry of Health in the Netherlands. I was supposed to be here with Giel, my colleague, whom you may know, but he is unfortunately ill, like so many people at the moment. So this morning I will be taking you through this webinar, and Johan has already told you what the rules are for questions. I'm really happy to answer any questions that may arise from this presentation, and I'm happy to do that in the chat and afterwards. So I was asked to present the work that we've been doing on the national policy priorities that will hopefully lead to stronger AMR policies in your countries. And I will give you an overview of the survey that we did, the needs assessment that we did over the summer last year. And we'll also go into the role of the country representatives / liaison officers that we have set up within JAMRAI. So some of you that I saw in the participant list are already present in the policy group, so they are the liaison officers. So hopefully this is not going to be a repetition, but we will be presenting some of the results of the needs assessment, like I said, and also explain a little bit on how we are working together towards these stronger national AMR policies. And then, as I said, the needs assessment, what are the main outcomes, but also just briefly touching on what are the next steps. So what are we going to be doing specifically this year and the years to follow within JAMRAI from the point of view of country commitments. And more importantly, also, what can you as a country representative do, as a liaison officer do, if you are wearing that particular hat? And for the people that are not a country representative or liaison officer, there are many ways how you can interact with the country commitment work package within JAMRAI. Right, you can see the screen. So let's carry on. How are we working together towards stronger national AMR policies? So as I've said, we have been working on the following, or are going to work on the following 4 things. So the main hub, as you like, that we have within JAMRAI for country representatives and where we all come together and work on our policies is the JAMRAI policy group. So this is the only work package / place within JAMRAI where, apart from the General Assembly, of course, but where all 30 participating countries come together and where we are working on identifying needs and gaps for implementing, developing, updating our One Health strategies in the national action plans. So we use lots of different words for this. So we're either talking about updating our national action plans or maybe developing the One Health perspective on it or fine-tuning certain things within the national action plans. But we also talk about related, policy-related or AMR related policies, because we feel that, yes, as member states, it's important to have a national action plan, but it's also very important to know that there are policies that are maybe mentioned in the action plan, but then being worked on or being drafted outside of the action plan. So we think it's very important to have that broader scope so that we don't narrow ourselves too much. But the main focus is, as you can see in the second bullet, to identify national policy priorities that we can then work on within JAMRAI. And the way we are going to do that, and we are starting now, is to have a need-based support program where we will offer a wide array of tools and methods to help countries to do exactly this. So to update their NAPs, but also maybe to make them operational when they are maybe not operational yet. And then, as I said, with this wider scope of also related policies. Yes, so the main way we try to do this is by strengthening our network, and this is because this is why we call the JAMRAI Policy Group a hub as well, because we want it to be a place where we can meet each other, where member states can form alliances with other member states and countries, where they can pick up the phone to one of their colleagues in a different country and say, I have this problem. I know that you have solved this by doing X, Y, and Z. And we really want to make this network happen. And obviously it's hard because we cannot see each other every week, but we try and do it through this JAMRAI policy group and have this hub working. And the exchange of best practices is another thing. So best practices, good practices is this sort of buzzword, but what we will try and do is identify, as I said before, which country has come up with a particularly good solution for a certain problem, and then try and adapt it so that we can work on it in other countries as well and can implement it there. So this is just briefly sort of the backdrop of what we are working on within JAMRAI and with all our liaison officers and country representatives. So what we have been doing since summer last year is that we've been working on a needs assessment because we needed some sort of starting point. We needed to know where everybody was, what their status quo was, and where they were departing from within JAMRAI when it comes to their particular national priorities. So what we've done is we focused on these 3 points, and as you can see, we've had 28 countries participate in this survey, which is really quite a good score, I think, which shows that everybody's very willing to look into what they are going to be doing within JAMRAI. They really want to have the results, and hopefully we will get there together. So we focused on an overview of the top 2 national priorities, which we will be working on in the next years. And also we ask questions about the status of the national action plans, and specifically also the structures that are around the national action plan. So do you have, and I will go into a few of the outcomes later on, for example, do you have a strategic plan? Is your NAP up to date? Is it a One Health NAP? But also, where are your biggest barriers to move forward with AMR policy? And then the last one, I just touched upon that earlier, are the sort of the good practices. I know that we don't really say best practices anymore, but it's a summary of lessons learned per country that we can then hopefully extend on and work on with everybody involved. So this is just a brief screenshot from the report. The report is being finalized now. We want to upload it next week. We have to make a few changes to, for example, the abbreviations of the countries, but everybody's on board with sharing it on the Teams environment, so that's where it will be. And then we will also talk about how we will do dissemination towards other stakeholders outside of JAMRAI, but that is the next step, if you like. So as I said, we have identified, or the member states, the countries have identified priorities that we will be focusing on. That was the first part. We've asked questions, for example, on do you feel that your NAP is fully up to date at this time? So here you can see the answer to that question. So 7 countries said it's not fully up to date, but I want to work on that in the next 1 to 2 years, which is perfect because that's exactly falls within JAMRAI. And to some extent, but it requires further development. And also some countries have sufficiently updated their NAP, which is obviously great news. And 0 countries said that it's not a priority for the next years. So when we look at the core components of an NAP, you probably all have seen that there are several components that you should have in your NAP when you're doing it properly. So the first one is a strategic plan. where you can see that there are 16 countries that want to really work on their strategic plan in the coming years. And then the second part of an NAP is the operational plan. So this is where you really start to go into naming and putting a timeline on it, and sort of being very clear and concrete about your actions. And you can see quite a big number as well of countries who want to work on their operational plan, or and also a few that already have that in place. An even larger number wants to work on their monitoring and evaluation plan, because we all know that that is actually the hardest part. So how do you make your NAP measurable? What indicators will you use? And more specifically also, how do you monitor any progress that you make on your NAP? And the last mechanism, the last component in an NAP or surrounding an NAP is the intersectoral coordination mechanism. And that is basically where you try and get everybody around the table. And when I say everybody, we want to have a One Health National Action Plan. So it's very important to have all the relevant sectors at the table and working together, or at least also working on their specific action points that you have in your National Action Plan. So we also asked the question is, does your country have a One Health National Action Plan on AMR in place? And this is actually a really good score. So 14 of them have it to some extent, but require it to be further developed in the next 1 to 2 years. 9 countries said that they have a very good One Health, or at least a One Health National Action Plan in place. And 5 want to be working on it as well in the coming years, but I have prioritized it. So that is good news, and also something that we can really work with. We know who these countries are, so we can very specifically target any work that we want to be doing together on this. So nothing is perfect, and there is always a room for improvement. So one of the things that we saw coming out of this survey is that there are specific sectors that have policy gaps or differences in policy comprehensiveness and that need urgent attention. So the very obvious one is environment, including ecosystems. So environment policy on AMR is still needs to be developed further. And speaking from my own experience, we do have a One Health Action Plan, and we do work together with the Ministry of Environment, but it just takes a bit more effort to do this, because it's not something that we have been doing before, and it's not something that we've been used to. The other one is plant health policy. So that also comes out as a sector that has a policy gap. And then you can see the other ones, so food safety, and is the next big one, if you like. And only one of them mentioned the animal health policy. So that is a good sign, I guess. So only one country naming that as they're having a policy gap. So when it comes to One Health dimensions of the NAP, we also asked, so what are your biggest barriers? What is the reason that you are struggling to have this One Health dimension in your National Action Plan? And here you can see the result of this. And by the way, the slides that I'm showing you now is obviously only a fraction of the report. And there's more context in the report for you when that arrives. Now, these are obviously sort of very big overarching results. So financial resources, human resources is another one. The lack of a well-functioning intersectoral coordination mechanism was mentioned as one of the barriers, because it really starts there, doesn't it? To have everybody at the table and to have also the other sectors being aware of the work that needs to be done and the importance of why all sectors should be at that intersectoral coordination mechanism table, if you like. So this is sort of the result of the barriers. There was also questions about, let us know, what are your good practices? What are the lessons that you've learned when you were developing your One Health Action Plan on AMR? And I have just not mentioned the countries here, but this is just, again, a screenshot. There is a long list in the report on good practices, and we are very much looking forward to working with countries on these good practices and to learn more about them so that we can then maybe transform them into something that works for other countries. And obviously there's no one size fits all, but we have to start somewhere. So that's one of the main focuses of this work. So briefly going into the next steps. Here you can see sort of the outline of the plan that we have. So on the left side, the outcomes of the needs assessment, where we will also, as I said before, disseminate the results to EU policymakers. Obviously, we will have to ask permission to all the countries to do that, because I think it's important for them to see as well what the outcomes are. And also, it's a good way of showing the national policymakers that it's not a struggle that you are in on your own. Other countries have similar barriers and have similar outcomes and issues that they're struggling with, and it always helps to know that. And then the second step is the part in the middle, where we want to go from priorities to actions and policies. That is really what we're aiming for. So we're going to try and do that by making roadmaps. So for the 2 national priorities that have been identified per country, we want to work on roadmaps. And the roadmaps are basically sort of mini action plans in itself. So we're not asking you to make this massive document, but we want you to start thinking, the country start thinking about how you can get from the priority to actually implemented policy. And that is the idea. And obviously we can't do that on our own. It's the other work packages within JAMRAI that might provide us with input, with technical assistance. We also have the possibilities of helping countries writing policy briefs, for example. And this is where I sort of go into the right part of this slide, is where we want to build our support program so that we can give this individual help to countries. And as I said, it could be writing a policy brief, or doing following a training on how to implement this particular policy, or having a work group with some like-minded countries that have the same or similar priorities. So the roadmaps will be very concrete steps to take in the next years, from getting from this priority to making that sort of a really active and implemented policy within the NAP. So we obviously asked, what kind of support do you need? Because we want to make this support program work for countries. So this is just one of the answers to the question that regarded the NAP and its One Health dimension and structure. And you can see that it's very clear that, and this is sort of a red line through the answers, is that countries are interested to receive a report and to learn from other countries. And some countries have also offered to mentor other countries and to work really closely with them in a sort of tandem or a buddy system. So this is these answers we will use to design our support program, and hopefully, together with the other work packages within JAMRAI, come up with a really good support system. So I know that not everybody attending today is a country representative or a liaison officer, but you are obviously from a country, and you are represented within JAMRAI, specifically within this work package 5. So what can you do? We have talked a lot about the role of the liaison officers, and in our last policy group, we also discussed what this role can be. So, and everybody's still sort of looking around a bit, like how can I fulfill this role to the best of my ability? So we came up with a list of a few bullets on what this role of the liaison officer can be. And I also want to stress that it's not just one person, this liaison officer. We see this liaison officer as the sort of the spider in the web within the country. that works together with other country representatives, because we want to have this One Health perspective, and you cannot do that within one person. You need the other representatives from other ministries or from other institutes to work together. So the role of the liaison officer, yes, it is one person preferably, but it's not a person that is doing this on its own. So this is what we have in mind, and this is what we've heard back from the liaison officers themselves. So we have a long list of contacts as well, but we are using the liaison officer to be the sort of main contact point for us, for other work packages, and for the coordination team. It's very important that the liaison officer can carry out the coordination of the objectives and the deliverables within the country, and that they are this spider in the web, if you like. They also have this role of being able to give or receive support from other countries, and also have an overview of the outcomes of the other work packages within JAMRAI, especially if the country is not participating in one of the more sort of technical work packages, because not every country is represented there, and it's important to know what is happening in the other work packages. And the other thing that is very important is to ensure the One Health coordination and cooperation is happening within the country. It's a lot to put on one person, so you cannot do this on your own, but you need to know who the contact persons are in another ministry, who you can call, to have this One Health perspective really sort of come alive within your country. And then lastly, last but not least, is the liaison officer and its sort of country representatives should really strive to translate and implement the outcomes of JAMRAI into concrete policy proposals. And this is what I've touched upon before. So this is how we have envisaged this role. And we're still learning, like we're not making it up on the spot, of course, but we're still learning on how to be this hub and how to work together. And this is really sort of the last slide, because we are getting some good ideas from liaison officers and country representatives on how we can really make this role more concrete. So we are very curious to hear from you. Any thoughts, ideas, questions, and suggestions on how we can shape this particular work within JAMRAI are very welcome and always welcome. I don't know if I've spoken too long, but I think it's 12 o'clock. I don't think I've gone over the time. Thank you very much for your attention. And obviously, if you would like to get the report, it will be posted on the Teams environment. But if you need to contact us and want the report because you're not on the Teams environment, do let us know.
So we have 15 minutes for questions. So if you have questions, just raise your hand or write them in the chat and Corine can answer them. No, I don't see anybody raising their hand. No question on the chat either. So
I'm just curious maybe to hear of people that are attending that are not liaison officers, whether they know who their liaison officer is within their country, or whether you do not know this.
That's actually a good question. Anybody wants to step in?
Camilla knows the LO. Camilla, I can't remember from which country you're from.
Hi, I'm Denmark, SSI Denmark. We meet regularly with Camilla Holtenmøller, who's our liaison officer.
Yeah, great. Okay, thank you. And I can see Oksana Hagar from Sweden. You're not sure who your liaison officer is? Can you maybe tell us where you are from in terms of where do you work? If you can.
Yes, yeah.
Hi, good morning.
Good morning. We're working with a work package 7, and I'm not sure. I mean, we're working with a tiny part of work package 7 a task. So I'm not very sure who our what's it called, representative is.
Yeah. Okay. I
But I will find out. I will find out.
It's Annette Hulth and
oh my God.
Maria Lindholm just by heart.
Okay. A lot of contact with them. Okay, I didn't know they had specific. Okay, thank you.
You're welcome. And they have been very active as well, and they have had some good ideas on how to involve liaison officers, but in a sense of how we can really make the contributions very concrete, because that's what we're looking for. We really want to have.
Yeah, I mean, you have a lot of contact with them, and maybe you don't know exactly what position they have. So yes, I have been working with them very much. Oh, thank you.
Okay, and then Ivars was saying, yes, we have a great LO. I met Uga Dumpis, and he is indeed great. He's very enthusiastic and very much on board in this project. So this is excellent news. Thank you. Was there somebody else who was wanting to come in?
Yeah, it seems that Portugal is also aware of their liaison officer.
Yeah.
I think it's all great news.
Exactly. Also on the Teams environment, if you have access to that, you could also ask us to have access to the Work Package 5 Teams environment, where you can have an overview of every country and liaison officer. And we're also trying to add the person who is holding the pen when it comes to NAP's development and AMR policies, because in that sense, that's quite important to know, because then it's not always a liaison officer that is also the policy maker, because that's the way it's organized. It's not always a ministry representative, and usually NEPs are sort of written, not always, but at ministry level. So it's good to have a sort of really wide net. We're throwing out the net very widely to make sure that we don't miss anybody. So that is the plan. So if you do want to have access to the Teams environment, let us know. Then there's a few more. Spain was saying, is there a list where everyone can consult? Yes. So Jennifer is writing. I could somehow add you. I think if I have your email address, I can get that through Johan. Maybe we can add you to the Teams environment.
Yeah, I think we could put maybe a list of name and countries somewhere in the Teams to make a tab with the contact, maybe not contact for GDP rules, but at least the name and the country of the person.
Yeah.
So, yeah.
Yeah. Okay. Yes, so Marta is a LO from Spain. Liaison officer Joanna Sandulescu, Daniel, yeah, excellent. So Romania. Yeah, so Johan, in terms of GDPR, if I add people to the Teams environment, is that going to work?
Yes.
Yeah. Okay.
And maybe on the general channel where everybody has access, we can just maybe put a list of countries and liaison officer, just the name, not the contact information.
Yeah.
But I think it could be maybe helpful.
Yeah, exactly. Okay, very good. Well, thank you for sharing your thoughts on the liaison officers, and I'm glad to see that at least the most part of you, most of you know who this is.
Any more question for Corine?
Maybe I can just briefly say that we're organizing, obviously you're organizing, and we are all organizing a great General Assembly meeting in Bilbao, and we will also have a side event for the policy group on the Thursday afternoon, where we will start working on the roadmaps and have also a brainstorm on the support program. So if you have any suggestions and ideas on how to really build a very strong and useful support program, we are very much open for this. And you can tell your country representative as well.
Well, I don't see any question. So maybe we can just conclude this meeting. Well, thank you, Corine, for presenting. So I just have one last slide. Oh, I closed the presentation. Just to announce our next Tuesday Connect, we will take place in March, actually. Here it is. You should be
Yes.
seeing my screen now. So, well, Corine, you already mentioned the Bilbao meeting, so we hope to see a lot of you there, and we already have a lot of registration. So thank you for your commitment, and well, we are trying to prepare a nice meeting. So, we have high ambition, so we will see how it goes. So I invite you also to subscribe to our newsletter if it's not already done. You will have a lot of information, and we also have weekly what we call a weekly digest. So sorry, I didn't put the link on this. So yeah, do not hesitate to subscribe to this weekly digest. So our next Tuesday Connect will be on March the 18th. So we will share the agenda in coming weeks. And next edition will focus on surveillance, probably animal and environmental surveillance, but we will share some more information soon. And finally, if you want to present in one of our upcoming Tuesday Connect, including stakeholders, we already received some proposition. Feel free to contact us on our secretariat address. So that's it from our side. So I wish you a nice lunch, and well, we look forward to our next opportunity to meet together. Thank you all.